cause. Second cause is friction. Okay. So this friction will cause abrasion of stratum corneum, especially when the skin rubs against other surface, say for example clothing or bedding. We change clothes for them, right? Many a times it is not easier to change clothes, right? So and we remove clothes or we put on clothes for them in a harsh way, so that will cause friction between the skin and the cloth. Other thing is when we are doing bedding. So at that time also many such steps we take, which tend to cause problems. Other is shear force. Okay, here the force is parallel to skin, but they are in opposite direction, right? So say for example the patient is lying down in semi uh, sitting position. Patient is in Fowler's position. And what happens after some time? Patient tends to go down, slide down, right? So again, there will be a in opposite direction, force will be there. Many times we try to pull the bed sheet, right? We try to take the patient up in the bed, right? So all these things happen many of the times and they cause problems, they cause injury to the skin. And moreover, when where bed sore take place, generally over the bony prominences. Okay, and our patients are very thin. They may be obese also, right? And they tend to develop bed sore. So let us see some of the risk factors. There are plenty others also, but generally what we come across in palliative care, I have included these factors. So the patient is having impaired sensory perception. Patient is not knowing what is happening to the skin. He's not able to identify the problem, right? So basically a sensation perception is not there. The other is impaired physical mobility. Patient is all the time in the bed or patient is wheelchair bound and he is not move at all on his own. So what to do? Patient is lost consciousness, right? And again lying in the same position for longer period of time, no one to care about. Right? So he will end up in the problem. Patient is having fecal or urinary incontinence and patient will be always in the environment that is always moist. So again, there will be injury to the skin. Maybe he is in altered mental status. That can include delirium or dementia, doesn't know, doesn't remember, right? Can't take decisions. So again, he will be in trouble. Patient is very much emaciated since long. He is not taking any nutrition, skinny patient, right? Many patients we have seen. Dehydration again can be because of many reasons, right? So with that also fluid and electrolyte imbalance has taken place. Patient is having edema, patient is anemic and the wound is not healing, right? So again can lead into problem. Hypoxia, when there is problem in the circulation, right? And because of the hypoxemic condition, the wound is not healing and the tissues have uh, necrosed. Hypotension, again there is problem in the circulation and body part is not getting enough nutrition, so that will lead to a major problem. Patient's body has lost power and there is excessive body heat, right? Advanced age also. We have, I'm sure each household will be having some or the other person who has entered old age, right? So they are also very much prone to develop bed sore. And other medical conditions also, diabetes, cardiovascular diseases, right? All of these conditions will lead into bed sore, can lead into bed sore, and we want to prevent it. Okay, and if at all it has taken place, then we want to uh, cure it. And if not possible, cure is not possible, but we want to give maximum comfort to these patients. So let us understand the pathophysiology. So all these risk factors will act on the areas of soft tissue that particularly are lying over the bony prominences, right? So when this pressure exceeds normal capillary pressure, there will be occlusion and tearing of small blood vessels will take place, and it will lead to reduced tissue perfusion, and it will develop into sore, right? Because of the ischemia and necrosis. So it will again, that can be small also, it can be large also. Now let us move to the stages. I know we all have learned this, but just to remind all of us to see and identify in which stage our patient is in terms of bed sore, so that we can take adequate precautions, so that the stage 1 pressure sore doesn't enter into stage 2 not into 3, and so forth. So in stage 1, that is the stage of erythema, right? So here you will see that the skin is intact. Okay, it will present with non-blanchable erythema, right? So if you pressurize it, the color will not change. It will be in localized area over the bony prominence, right? The skin will appear warm. There can be edema, and pain also may be present. So this will indicate that the person can lead to further into pressure sore. Okay, so put these patients in the list of at-risk persons. Okay, so you can see here the redness, right? And real patient is also shown, and schematic diagram is also shown here in this slide. Now, what happens in the stage 2? So here, partial thickness skin loss will be seen. Blister also may be present. Okay, so there will be loss of dermis, and you will be able to see a shallow open ulcer, reddish pink color, okay, and without slough generally. Epidermis and dermis, both layers are injured here, okay, and it will be, of course, painful for the patient, right? So further, we need to treat it. Stage 3, here there will be full thickness skin loss. The fat will be visible. You can see in both the diagrams. Subcutaneous fat will be visible, but not the bone, tendon, or muscle. Okay, it will be in the next stage. Now, subcutaneous layer has poor blood supply, so it will be difficult to heal. It will take little longer time for healing to take place. There can be necrosis of this tissue also. And stage 4 will show us the bone, right? Tendon, bone, muscle also will be exposed here. Okay? And there will be loss or breakdown of the supporting tissue, right? So it is further becoming more and more difficult to heal it. There will be one more stage that is known as unstageable. Here, by looking at the first, you will not be able to know the depth uh, because the color will be different, right? It may appear blue, black like that, but there will be a lot of slough also, ashar also, right? So when we clean it gradually, we may come to know, and then maybe it may happen that there will be lesion which will have different stages. Okay? Each part of the lesion will have different stage. That can also happen, and there will be extensive tissue damage. Many times it may require surgical removal of the part so that we can see the uh, fresh blood coming out. Okay, so we know that okay, some blood supply is there around there, and then we can have other possibilities like skin grafting or any other thing, right? And our bed sore can complicate with other problems like cellulitis can take place, bone and joint infection will take place, sepsis can also develop. Okay? So what will be the aim of whoever is responsible for the care of the patient with bed sore? So first and foremost is to relieve pressure and prevent further complications. So what to do? Okay, so care of the skin and general points if we want to look into, then first and foremost is general hygiene of a patient. Right? We need to give good sponge bath or good bed bath, whatever is possible. Cleanliness is most important. Change of the position every 2 hourly when the patient is in the bed. It is very important to change position, uh, maybe actively, maybe uh, passively. If there is any wrinkles in the bed, then that should be removed. Avoid any shear and friction when we are taking care, and notify, teach the caretakers also, and of course the regular inspection of all the points whenever we are giving care, whenever whatever procedure we are doing with the patient, we are talking with the patient, always be very much observant. uh, so in skincare, what to do? So after bed bath, good bed bath, always dry it thoroughly, right? And wet drying is the best, not to rub the towel very vigorously against the skin, because the skin will be very fragile in our patients, right? And we always see to it that skin is supple. Okay, so for that, we don't apply talcum powder, but instead we try to keep the skin moist. Okay, so for that you can use liquid paraffin or white petroleum jelly or Vaseline, right? As per the economic condition of the family. And very commonly available in all the households will be the coconut oil. Okay, so when to apply and how much to apply? Many will say that, okay, how to apply oil or Vaseline in hot season. So when after we give bath, immediately the amount now will vary if it is in hot season and in the cold season, right? So take enough moisturizer and apply with your hands, right? And rub it nicely so that the skin will be moist always, and it will be enough moist, not too much of it also, so it will not be a problem. uh, all the care, supporting care is also important. Exercising, right? Recreational therapy is also important because that will also make patient happy also, and will be moving also, right? Diversional therapy is also good, and occupational therapy is also good. So that will help in taking care of skin also, right? Not just a sponge bath and massaging. Other things are also quite important. So we know these are the pressure points, right? So when the patient is in supine position, we should remember what are the pressure points, right? So whenever we are turning the patient, we will look at these points and identify if there is any skin changes are present. When the patient is in sideline position, so you can see here the pressure points where the pressure sore can develop. Yeah, and when the patient is in the prone position, so at that also we can look at the points, right? So whenever the patient is in the bed, change the position every 2 hours in day. And what about night? Many will have this question. So do we disturb the patient to change position? Then no. But when the patient is getting up during night time, say to have some medicine or maybe to have a glass of water like that, so at that time you can very well change the position. Okay, so once in night is enough. What about the patient who are in the wheelchair? Okay, so it is advised that every 15 minutes, some movement of the patient is required so that he doesn't develop pressure sore. So here also you can see the patient who is in wheelchair and where all he can develop the pressure sore. Right. So always keep some padded part, right? So that there is no vigorous pressure at the knee, right? And the sacral region. There will be a lot of pressure on the ischial tuberosity also, right? When we are in the sitting position. So padding at that point is also important. So it may happen that always there may not be some cushion. Okay, but patient can always use folded sari or soft cloth at these points so that the part is well protected any pressure sore. Many times we see that patient is sitting on very hard surface of the uh, wheelchair. So it should not happen. It may not be wheelchair also. It may be simple chair, right? But always keep the part padded. So it is soft at the bony prominences. Gentle massage is always good. Okay, but we should see that avoid pressure points which because the patient can be very skinny, so it should not happen that because of our massage the skin is getting damaged. Yeah, and always no massage over the pressure sore. Passive stretching of each joint at least 10 times uh, in the morning and in the evening is necessary so that it will prevent any kind of contractures and atrophy also. And of course, prevention of the deep vein thrombosis will be helpful. Positioning of pillows, of course, is very much essential between the joints, especially in sideline position, right? So when you have put the patient on left side, for example, keep a small pillow between the knees and between the ankle joint so that there won't be any rubbing of the skin. If pillow is not available, then soft cloth can also be used at these points instead of pillow. So padding of bony prominences for protection is very much essential. We have seen these mattresses right in the hospital, but should not forget the patient on it, right? All the other steps are always important and continue the skin care whether the patient is on the air mattress or not in the on the air mattress. It is not the final solution. And when nowadays such mattresses are also available at low cost and on rent also. So we should know the agencies also, NGOs also, who are providing it, and people keep it at home also for the patients when the patient is chronically in the bed. Okay, but always instruct the caretakers that the skin hygiene is very important, and there is no other option for the skin care. Okay, so air mattress or water mattress is not the final solution for the prevention. Okay, it will help, of course, in spreading the weight equally, right? But care always will remain important. With proper treatment, most of the pressure sores will heal. Okay, so that's why the patient should not land up into the last stages of the sores. That is very important. So what will we remember? We should remember that the healing will depend on general health of the patient, diet of the patient, relief from the pressure on the sore, and careful cleaning and regular dressing. So whenever we are taking care of the pressure, so how we keep clean them? Yes, so always prepare normal saline solution. Teach patient and caretaker also how to prepare at home, because again, patient may not be able to buy. But some of the agencies, some of the caretakers, hospitals and hospice centers, they do provide material also free of cost, but we always need to teach the caretaker how to prepare it at home, right? That you must have learned in the palliative care how to prepare it. So clean it with the help of normal saline, irrigate the wound, yeah? Not to use any material and any cleaning solutions like hydrogen peroxide or betadine for cleaning. It will do more harm than helping. Okay? Removing of dead tissues should be done, so that we know that healthy granulation tissues are taking place, they are coming up. So that will should be seen. Scab also can be removed gently, okay, not to injure the healthy tissues. Use moist dressing material that will prevent damaging of the granulation tissues while changing the dressing. And how to change? When you are removing the old dressing, always soak it and then remove it. So it will prevent any further damage to the newly coming tissues. Pain relief from the dressing is also very much important. So extra dose of painkiller drugs should be given, be it morphine or any other drug. Okay? So if what time dressing should be done? Ideally, it should be done when the patient's regular analgesic timings are there. After half an hour you can do, or if it is not possible, then give extra dose of the analgesic drug just before 30 minutes of the uh, dressing change. Because whatever you do for the patient, it will always remain in his mind, right? So if the procedure is painful, then when you are trying to do it, the first thing will be reminded in patient's mind is that of painful experience, and you may not be able to get adequate support from the patient. So it is always beneficial that we keep the procedures pain-free. Any kind of procedures which we are doing for the patient should remain pain-free. What about the nutrition? Right, so healthy diet is very important in preventing skin breakdown, and it will also aid in wound healing. Right, so extra protein, extra vitamins, especially vitamin C, A, E, all these are important. So we should know the resources, local resources, especially which provide all this. okay, and advise the caretakers so that they can provide such good nutrition to the patients. Adequate hydration to maintain the skin integrity is very much important. So taking enough fluids in any kind, it will be very much beneficial. Lifestyle changes may be required. Many of the patients might be taking smoking, doing smoking. So we have to tell the patients that to stop smoking because it also hinders not only in the healing process, but it damages the minute blood vessels, right? The intimal layer of the blood vessels will be damaged because of the smoking, and it will further lead into problems. Exercise is also good. So daily exercise is good for improving circulation. So that should be remembered. It will also help in prevention of contractures. Controlling incontinence, right? So appropriate measures okay, so when there is incontinence, we have to see into it that patient, if is not able to control the urine, then maybe catheterization may be required. Right? So whatever methods can be used, that should be used. And for the stool incontinence, also we should take appropriate measures. Cleaning should be adequate. Okay, so that there is no skin excoriation because of the stool and urine incontinence. So that care should be taken. Use of the other materials like soft clothes can be used. Many times it may not be possible for the patient to buy diapers. Okay, because many times it happens that patient is tied into diaper and then diaper rash take place. So such things should not happen. And patients are left in the diapers and then not taken care of. So such thing also should not happen. If required, antibiotics can be given if the wound has become infected. So appropriate dosage should be explained to the patient and the caretakers so that they are given in time. Educating the caregiver is very essential in all the aspects because patients, most of our patients will be at home, right? So how to take care of patients at home will be sole, these caregivers will be sole responsible for that. So from our nurses side, adequate home visits should be there, evaluation should be there, whatever procedures are done, right? So we can have continuous review of the patient's condition. Surgical repair, again, it will be nurse's responsibility in the pre and post-operative care when the patient is admitted, right? So many of the bed sores may require tissue flap and other plastic surgeries. Other treatment options are like hyperbaric oxygen. Again, it will be helpful when the patient is in the hospital setting, right? So when it is used for the tissues which are starved of oxygen, so here high pressure oxygen is provided with the specialized equipments, and we can help out the patient who are having deep-seated bed sores. Other methods like topical use of human growth factors is also good, and they help in the cell metabolism during the wound healing. So when patient is in the hospital, there are plenty of other options. but many of our patients may not be so much, uh, I should say, they may not be that much possible to come to hospital and get treated. So whatever is happening at home, we should teach them. This is one such bed sore you can see in the heel area, right? So you can say that it is unstageable. So for such sores, we can apply the vinegar also, that will help in removal of the HR. Okay, and once the HR is slowly removed, it may take 2 to 3 days or even more also, depending on how deep it is, right? So with that, uh, how much strength should be used? So it is 1 ml of vinegar and 9 ml of normal saline, and then you dip the gauze piece into the solution and keep it over the HR. Okay? So the slowly it will get removed. Sometimes it may be used, like petroleum jelly is also used for such things. Locally, papaya leaves are also used when the skin is uneven. So at that time, you can directly apply the papaya leaves and even raw papaya slices. And when the skin is uneven, at that time, you have to mash them and then apply. These things may not have, and I mean, they may not be mentioned in the our textbooks, but at local regions, many people use it. Even aloe vera pulp is also used for the bed sore dressing. So there you need to remove the skin and take the pulp and then apply directly over the dressing material, and then put the dressing material over the bed sore. So in that way it is done. Use of metrogel tablet powder is also very useful to keep the odor away, right? So after cleaning, all these things can be used. In generally palliative care settings, we don't use betadine for the dressing, right? We always do it with the help of petroleum jelly. It has good healing power. So apply petroleum jelly and then uh, apply the gauze piece, preferably again Vaseline gauze, so that it doesn't adhere to the skin when you are removing on the next dressing change. Okay, so let us summarize what is the role of nurse in prevention and management of the bed sore. Right? So continuous assessment is important, uh, and identify the risk at risk patients. So assess the client for any predisposing factors so that he would develop bed sore. Uh, Skin condition should be assessed at least twice a day, right? So tell the caretaker also to do so. Whenever we are changing position, we can always observe when the patient is in the hospital, right? So that should be done very honestly. Inspect each pressure point, palpate the skin for any kind of increased warmth, right? So we know the condition of the skin. Inspect skin for any dryness, moisture, too much of moisture, any breakage, any skin discoloration, how much mobile the patient is, how much he can do, how much we can help, right? So active and passive movement is important. Circulatory status of the patient, right? Check peripheral pulses, how good they are, what are the normal, always should be assessed so that we know that the area is having good blood supply. Uh, Assess neurovascular status of the patient. Determine any presence of incontinence, right? Evaluate nutritional status and hydration status. See that the skin is moist, it has not become dehydrated, and stretching of the skin and everything is in normal condition. That should be evaluated. See that whether the patient is able to take nutrition orally or not. If the patient is on rice tube feeding, then how much he is able to take it, right? What the patient's relatives are giving. All these need thorough exam assessment, and whether your instructions are properly followed or not. So good communication skills are also very essential. Always ask the relatives to repeat whatever instructions you have given to them, right? So that you know that your instructions have properly reached to the learner. Uh, any other health problems, if they are present in the patient, then assessment of that problems are also essential. And of course, not to forget to assess pain, because that is also very much important. We know this Braden scale, right? So whenever we are doing assessment of the patient, we can always have this scale with us. So with that, we will come to know that where our patient lies, in which group, right? So depending on the total points, we can identify whether patient is at severe risk if he falls below 9 point. If he is in a higher risk group, the points will be 10 to 12. Okay, his score will be 10 to 12. If he is at moderate risk, his score will be 13 to 14, and mild risk patient will score 15 to 18. Right. So all the 5 points you can see here and score appropriately. Right. So then we can find out the at risk patients very easily. And when we are making home visits, at that time we can always ask the questions to related questions to the relatives. Okay, so we can find out what are the other roles. Interventions for patient with decreased sensory perception. Assess pressure points for the signs of bedsore development. Provide pressure redistributed surface, maybe by means of the air mattress or water mattress. Interventions for incontinence, we know how to do, right? Clean the area, drying it thoroughly, and moisture barrier ointment can be applied. So further problems do not arise. And of course, how to do, keep the patients away from friction and shear force. When the patient is having decreased activity and all, we know, we just saw it, right? Turning and active exercising and passive exercise of all the joints, not just one joint, all the joints, it is important. And what to do in nutrition. Okay, so when we are going weekly or once in 15 days, we should note the progress. Okay, many times we do take the photographs, so we can compare it. In that way, it is very good. Assist the physician or surgeon in debridement whenever required. Right? Educate patient and family regarding the risk factors also, and treatment also. Not to forget to document. So with this note, I would like to end my presentation. We can discuss if there are any points. Thank you for listening me patiently.
Thank you, Anna ma'am. It's your time for you participants. If you have any doubts, you can unmute yourself and speak up. Or you can put your questions in the chat box and I can read it out for Anna ma'am. No doubts?
Hello.
Yes, Jomi Chapo.
Hi, madam. Just one doubt. It's regarding to provide the patient to the dry oxygen for the bed sore patient. So is it a good practice, or is there any evidence-based data regarding this practice?
I personally have not seen. I have. I mean, in our hospital, it is not available, this equipment. But I read many research articles that it is helpful for the patients, especially those who are having very poor circulation. So in them, it helps.
Okay, thank you.
Anybody else? There is no other doubts. We could go to the case presentation. Today we have case presentation by Ashwadi KV Nair. Ashwadi ma'am, are you there?
Yes, ma'am.
Okay, Anna ma'am, can we go to the case presentation now?
Yes, we can go.
Yes, yes.
Okay, then I will share the screen for you, Ashwadi ma'am.
Thank you. Yes, sir. Can we start, ma'am?
Yes, Ashwadi ma'am.
Good evening to all. Good evening to all. I'm Ashwadi. I'm working as a staff nurse in Vibe Health, and today I'm presenting with a pressure sore. I got a patient. Next slide. My patient, 72 years old, male patient, is diagnosed with pressure sore and aspiration pneumonia, type 2 DM, hypertension, and coronary artery disease, and all coronary cerebrovascular accidents. Next month. We are giving mainly the care into their home. When we are reaching there, they complain about the bed sores and cough and reduced response to speech. Now the response are changed. When we are reached there, they complain about the pressure sore, cough, and response to speech. The history of illness: he was admitted to a nearby hospital with complaints of decreased response and inability to move all four limbs and inability to speak. He was diagnosed with CVA, hemorrhagic stroke, and was treated with the same. He is a non-diabetic hypertensive with coronary artery disease, not on regular treatment. Bedridden since December 2021. And by examination, patient is bedridden. Now he changed to response. When pain, we are giving pain, the patient will open their eyes and producing incomprehensible sounds. And patient on feeding tube and catheterized with Polis 16 with favorable urine output. Temperature is normal, respiration is spontaneous, circulation we are felt peripheral pulse very well, and births are 3 in numbers, one in sacral and bilaterally gluteal region. And treatment, patient was admitted and started on IV PIP test and other supportive measures in the hospitals. Surgery consultations were done and necrosectomy was done. Presently, we are giving the dressing. We are cleaning with the normal saline and necrotize the removing the tissues and giving in metrogyl ointment, applying the metrogyl ointment, giving the clean dress. And tissue culture and sensitivity done. We are getting moderate growth of Acinetobacter. In while evaluation, HB 10.5, serum urea 91, and creatinine 1.7, sodium 132, and HbA1c 6. In medication, patient injection PIP test 4.5 gram IV BD, injection Pando 40 mg IV stat, and regular cleaning and dressing. He is already on tab isoleucine half BD, tab Rosacol 10 mg HS, tab Lavidlone 6.25 mg BD, tab Syndopa plus half Q6H, tab spironolactone OD. The psychological aspects, concerns of family members about his health, financial crisis, and loneliness. The main concern is fungating wound, concern of family members. In summary, 74 years old male with pressure sore treated with the regular cleaning and dressing. The discussion points are wound management, psychological support, support to family, and community engagement.
Anna ma'am,
Thank you, ma'am.
can you lead it?
Yes. So, what can we do for this patients? What are the inputs from the all nurses here? What can we say about the wound management?
Ma'am, we are giving, we are a virtual hospital. I am working in a virtual hospital. We are giving the care in their home. We are giving regular dressing on daily with metrogel and cleaning with a normal saline. And we are removing the debris using the debris faster. Now we are scraped with blood and we are giving, applying the metrogel and giving dressing. Now it's most of them is cured, ma'am. We are started on the December itself.
So when you started the dressing at that time, what was the stage of the bed sore? So now it is improving, right? He is improving. So that
it is fungating and black in color. Tissues are black in color and a deep wound. Now it will the tissues are grown up and it's most often covered.
So he, whenever we just have seen in the presentation, right, that we should assess it, right, at what stage it is, and then immediately take the action, right? And further, we have to tell the caretakers that because bed sore can take place second time also, right? First may come out of it, then again he can lead to further, because now as the age is also more, he's may not be able to move himself normally, right? As you said, he's bedridden, right?
Bedridden.
So yes, so it is very much essential for the relatives that they keep him as I mean comfortable as possible by all the other things, right? Regular
yes, ma'am.
hygienic care.
We produce the airbud and teach the
Airbud.
family members to change the position and feed regularly, more water, and we are producing the pillows on the legs between the legs when the patient changes to sideline positions. And most of them, when we are applying the water in gloves under the elbow for reducing the pressure, so ma'am. So they will not get the pressure.
Yes. Soft clothes can be put under the heels, also elbow, also under the occiput, right? So
Yes, ma'am.
such soft padded things can be used. And of course, keep the skin, it should not become very dry. Otherwise, again, peeling of skin will take place. And another important thing is that when the caretakers are taking care of the patients, always encourage them, because they are the ones who are always 24/7 with the patient, right? And with the help of them only, patient is improving. So encouragement from us, the healthcare professionals, is also very much important. So that should also not be forgotten. So that's
Yes,
a
ma'am.
good sign that your patient is improving in the sense of the bed sore, right? So how
And also
good you? Yes.
the family members are also very lovable to him, ma'am. They are caring very much.
That's good. So with the help of the community, it is essential, right? Community help is also required. So we also we should have family meetings with the relatives, because through whatever care we are giving to the patient, they will get motivation, right? And they will try others also. If such patients are there in the community, they also, all those who require palliative care, such patients can be uh, I mean, referred to the palliative care team. So that is very much important. Uh, so that's good that wound is getting healed. That's very good sign.
Thank you.
What about psychological support? Let others also answer. You already have the patient with you, right? So you know everything. So what other have to say about the psychological support of this patient? Patient is in bed since long time, right? Uh, since December 21. Yeah. So now it is almost, say, he is in 4th month of that condition. Right. So what do you say about the psychological aspects of the patient also and the caretaker also? Relatives may be having many questions regarding the patient's ability, whether he will be able to come out of this condition or not, right? That will be the first condition, first question, I should say, right? Plus patient is also has the problem of aspirational pneumonia, right? So patient's feeding positions should be checked, feeding and whatever. Patient may be taking semi-solid food, or say for example, even for water, because every time it may happen that the patient is not able to support himself, and always even for lifting his head, making him to sit in semi-fowler's position, and like that, patient may be dependent on the relatives. So that is why there was a problem in swallowing. right? So that was maybe the reason for developing aspirational pneumonia. So it can lead to other respiratory depression also. So such episode should not take place. That care should be taken. So patients, relatives should be uh, taught how to, I mean, what can be the best positions for the patient to take food and liquids. So that should be dealt with. Right? Other psychological problems, patient may be having, relatives may be having, caretakers are not able to go out, or caretakers, because it is 24/7 duty, right? So anyone will take, will get exhausted, right? That will be the condition called burnout. How they caretakers will also be very tired, right? So someone should be there. They also will have to meet their needs, social needs also, and they may want to go out, right? So there should be someone who can relieve that person. That is also essential. So that is only possible with the help of help. Right? Others should be ready, uh, because in happy times all will be there, but in bad times very few will come forward to help out. Right? So this is the best case we can say, that the person, the caretaker also require good support from other family members, maybe distant also, may not be always near family members. Nowadays, there is another social problem of nuclear families, right? So that is another uh, thing to look into the matter, that uh, only husband and wife will be living. When he is there, maybe a wife is taking care of the person. That can be there, but they also will have limitations, how much support they can give. Anything, anyone, any other person thinks differently? All have to take part, right? That is the thing. When we are meeting on the net, we are not in meeting person. So your inputs is also required. I can see many out of India also. So what practices are followed in other countries also, we have to learn from each other. Right.
Thank you. I am Antonia from Uganda. My concern was about whether the patient is totally bedridden or is able to sit up with support. But I have got my answer. The patient is completely bedridden. In the case where a patient can at least sit up, it helps in feeding to avoid aspiration pneumonia, and also it helps in changing the position. And as you've said, the family members are the biggest support for 24 hours a day. So we have to also encourage them to change the patient often. Many times they are busy with their duties, but they need health education to understand that changing is important to avoid bed sores. They are difficult to heal. But the patient is totally bedridden, so feeding must be very difficult to avoid aspiration.
Yes, yes, ma'am. That is true. When we have a person in our home, then only we understand others' problems. So that is a big challenge, to take care. Even with the person may be normal, but person is not mobile. Say in the case of old age person, right? Patient may be completely healthy, but once the person goes into bed, to bring the person out of that condition is very, very difficult. And when we see the person going shutting down of all the systems, it is more and more become more and more painful for the caretakers also. So caretakers require a lot of encouragement. Patient maybe whatever is good, whatever they feel like doing, like watching or listening to music or whatever. So such things are also very much beneficial to keep the psychological stability. That helps. Many times they tend to abuse people who are caring, right? So caretakers also, their interest decreases. That also can happen. But whenever we go for home visits, we always need to see to it that the best possible things are done for the patients. Support to the family. Many times there can be problem of economical support also. So we need to identify the sources, NGOs who can help. Sometimes there can be a case of non-employable thing, unemployability also. That also helps somebody's education, how to help. uh, those things are also very much important. So we should know the resources from where these help can be available for the patient and the relatives. Uh, so that is important. Community engagement, in that way also they can help. Somebody can be a supporter, somebody can help in bringing medicine, some can help in cooking, right? In that way also the community can support, neighbors can support to the family. Somebody can have provide tiffin services. There are lot of things. When we jot down the problems of the family who is in trouble, we come to know how we can help them. So that is the community support, we can say.
Thank you, ma'am. Is there any questions left? I think everyone understood everything. There are no more questions. And there are some comments on the chat box. Assess the pain of any degree and give proper treatment for his pain. Then proper pain assessment and management is essential. And keep to organize visits, patients, house, and organize relaxation meditations. And such comments are there in the chat box. I think there is no more questions. If anyone have any doubts, you can clear it now. We have time now.
Yes, Gabriel.
Mr. Gabriel, do you have any doubts?
Yeah,
Yes, please. I think we lost his connection. Do anyone have any other questions?
Yes, so communication is the best medicine, right? Spend time with the person who is suffering. So that is best thing. Someone has written about the spiritual aspects, meditation. All these things are very important and helpful.
Then I think we can wind up this session. Thank you, Anna ma'am, for being with us here today. And looking forward to have many more classes with you again. Thank you so much. And all of you, kindly please provide your feedback. The link will be shared in your WhatsApp group. And I have released your second assignment. The last day to do your assignment 2 is 31st March. Please do it before that. And the last date for your first assignment is today itself. The link will be closing from 6 p.m. onwards. So if anyone is yet to submit their assignments, please do it today. This is the last day. And thank you once again. We'll see you on the next class. Then bye.